So we've done everything to actually provide a better healthcare experiences to the patients, and the patient actually doesn't care in what operating model is the doctor sitting on. They want a good doctor, they want good services. If you get really honest about conversations around TAB, I don't think founders really care about the TAB. I have let go of deals which I thought didn't make the right fit at the center, and we've also let go of doctors that didn't fit into the model 3.
Hi Zeeshan.
Hi.
Welcome to OpenTab.
Thank you.
Thank you so much for taking out the time. As you know, OpenTab is a series where we have open conversations with founders in terms of what they're building, how they're going about it, what's the journey. Why don't you tell us what is Docube?
Cool. So the idea for Docube was always to create a efficient outpatient care network that India lacked. Right? India usual outpatient departments either sit inside hospitals or are fragmented outside. So the idea was that can a organized outpatient care network be created in India? Because again, it has a fair amount of value, not only in terms of what a business can do, but in terms of health outcomes, because repeated outpatient care visits would lead to better outcomes in patients. Knowing that is the space that we wanted to hit, we went to market actually with a two-sided proposition, right? Where on one side, we work with doctors and healthcare brands, help them set up and scale their physical practices in that sense. And on the other side, for the patient, the proposition is simple, right? In one center, one location, in one visit, your entire outpatient care journey should finish, which could involve specialist consultations, lab prescriptions, pharmacy prescriptions, and diagnostics. So we created integrated clinics where all this can happen at the same time.
Got it. So, simply speaking, is this like a WeWork for doctors?
Not a what answer. So, no, right? Docube, again, the origination of the idea is outpatient care network, right? How we went about it for operational leverage with the subscription for doctors and healthcare brands could give the idea of WeWork for doctors, right? But let's peel that in itself, right? WeWork gives you a space, gives you a meeting room and a chair, and then wishes you all the best, right? So after that, there's nothing. Us, on the other hand, have the staff and operations managed for the entire center, which requires a lot of infrastructure and equipment to handle outpatient care. We actually assist our doctors to present themselves better online. We help them out with baseline level marketing. We have an entire tech stack that helps them manage their practice, right? From their telemedication to the EHR, EMR, billings and all that in that sense, right? Plus the center itself has labs, pharmacies, scans, which are owned by us, but which completes the outpatient care journey, right? So yeah, if WeWork starts doing everything that is needed for a startup to success, then it is close to being WeWork for doctors. My patient comes to me for labs, scans, pharmacies, and consultations. We are serving outpatients more than anything in that.
So you've been a doctor yourself, and then you went to ISB, and then you did strategy consulting in the healthcare domain. Walking away from a career or a track like that, why would you start building out clinics? It's healthcare is a tough nut to crack.
Yeah, so luckily for me, I come from healthcare, right? I'm not an outsider to healthcare, right? We've seen a lot of healthcare revolutionaries come from outside and say that it requires consumer level or consumer grade care centricity. True, in senses. But I'm a product of the healthcare system, right? I finished my med school in Hyderabad. I worked with government hospitals like Usmania. I worked with private hospitals like Apollo. Of course, there is an access problem. There is an affordability problem, which gets pitched as a bed problem, as in like there are not enough beds in India and all that. But if you take a step back, India's always had a access problem, whether it be distance or whether it be cost. That doesn't get solved by like 35 hospital chain or a 50 hospital chains.
Mm.
It requires outpatient care or ambulatory care to happen in a fairly consistent and good fashion for it to solve the problem of healthcare, right? Because 90% of your healthcare interactions are in ambulatory care or outpatient care.
You mentioned distance and cost. As a consumer, for me, experience also matters, and
Of course.
I can say with some of the most of the large hospitals, even a simple checkup or a simple consultation takes away 3 hours of my time within the hospital itself.
Correct, and that
Should not happen.
Yeah, that's a fair ask from the consumer, right? So before we did this, we of course talked to a lot of doctors, but we talked to a lot of patients also, right? And the constant, like almost every time, it was, hey, it takes away a whole day if I go to the hospital. I don't know what is going on. I want more time with the doctor, which doesn't seem to be the concern for them. And I'm just running around pillar to post, paying bills in that sense. So the idea, again, I have doctors who are working for these large hospitals who do their private practice, right? You get more time with the patient, it's a safe environment, and everything is done conveniently. So, in a way, by doing better outpatient care, you will be taking healthcare to the consumers rather than the patient coming to the large hospital each time.
So you are a doctor yourself. Karthik, by education, your co-founder is a chartered accountant, and he's done healthcare consulting. And Azhar is a techie, having worked with Microsoft and Adobe. How did the three of you, different sort of backgrounds, different career paths, come together and solve or try to solve for something that is so complex?
So at least the common point where we met is ISB, so that I think got us in the same room, so to speak. But speaking of for myself, at least first, I think in second year of med school, you're taught about a common trilema in healthcare, right? Which is the iron triad of healthcare, which says that any healthcare system cannot solve for access, quality, and affordability together. Although, if you go deeper into the problem statement, you do realize that if you use digital technology with the outpatient care, you can solve it. So I actually believe that I'm solving a 3-decade-old problem with Docube. Karthik, again, was a super bright CA, was a management consultant before ISB, moved as the strategy head for Indigene after. He was always a little irritated about the lack of transparency and infrastructure in the healthcare system. So he's very on board Mission Docube, right? Actually, if you think about the initial idea, the Eureka moment has to be credited to him in that sense, right? Because we both used to discuss ideas and all that, and what would a shared economy look like in healthcare is actually him. Azhar has moved around a lot in his life, right? A little too much, like from schools to jobs, is always on the move, and the complaint is constant, right? Why is the healthcare experience in India really bad?
And this is a question that has been asked of me as well when it comes to Docube. That is this a real estate utilization play where you have a fixed space available and you are sort of sweating it out, or is there more to it?
Of course, again, आपसे 2 बार पूछता था, मेरे से 10 बार पूछा जाता है. So is Docube a real estate play? Really not, right? If it was a real estate play, I would have taken a long-term lease. I would have crammed it with as many doctors I could have find at whatever price point that they were willing to pay to me. But that is not what we do actually, right? We actually do the opposite.
And you come from real estate background in terms of where your family comes from, so you could have done the classic real estate if you wanted to do real estate.
No, so what we do is literally the opposite, right? We have not taken doctors that we didn't think fit our center ka model or specialities. We have let go of doctors who we didn't think are going to crack their private practice in that sense. Plus, I've invested heavily into the way the patient flow moves, the equipment, the minor OTs that are there to assist the doctors, the nurses that are trained. So we've done everything to actually provide a better healthcare experiences to the patients. And the patient actually doesn't care in what operating model is the doctor sitting on. They want a good doctor, they want good services. So what we have done basically is created a supply side proposition where I get a lot of specialist doctors to be at my center and give out the services while they are making bank. And on the other side, this is created to help patients in that sense. Right now, just to play that analogy out a little more, Apollo Hospital is sitting on prime property in Jubilee Hills. Does that make it a real estate play? So every storefront in India that way is sitting on somebody's real estate. So the business model is created with a lot of nuances, and each currently I operate in about 6 or 7 revenue streams. Of course, they have their own nuances if I'm able to make money in that. So I don't see it as a real estate play. A lot of people, what they hear first about us is the misnomer we work for doctors in that sense.
Got it. So what's the defensibility or the moat here? Doctors will go where there is revenue or patients, because when category creators create the category, they invite a lot of competition.
Very good question, Govind sir. Again, something that I have learned over time also. But as we moved in this journey, we realized that the space, as you said, very rightly said, the doctors are not loyal to the space or the building. They are loyal to their customers and their patient pools in that sense, right? Yeah, anybody can make pretty looking clinics, but what it takes to get the right mix of doctors, to win their trust, run the entire model in a way that is beneficial to patients, the entire outpatient care journey is there. There is tech enablement, and then day in, day out, you have to deliver quality service. With all that combined, what happens is that each node of the network becomes sustainable, but the network tend to work with each other in tandem, right? And that becomes the moat, right? The network itself is the moat for the business. It's not about creating capital efficient infrastructure for healthcare.
Give us a sense of the current scale of Docube's operations.
Currently, a large part of all of my business is currently in Bangalore, right? And we have been able to go to 5 centers in that sense. I launched my 5th center in June in Kalyan Nagar. Other than that, I always had Koramangala, Whitefield, JP Nagar, and Sajapur Road. So 5 centers, we have seen over 60,000 patients. We have 120 doctors going in and out. Plus, then I have 9 anchor brands that work with me, like people like Amaha, Archish, Kapiva. Then there is Smiles, which is into GI surgeries. Going forward, I'm going to get 2 more centers in Bangalore, say by November. I do want to enter Hyderabad and Gurgaon by the end of the year or early next year. In that sense.
So, give me a real example. How has Docube changed a doctor's life or a healthcare brand's operational sort of model?
Cool. Let's take each example, right? So for the doctors, I love giving Dr. Nitish's example. Right? He's not only my first client, he was literally my the first people you talk to when you started doing market research. So he was one of the doctors that we did our first research on, and he actually gave us fairly good insights. Again, I've been going about it that it's not just about space, it is about the people, the marketing, the brand that is to be built, the doctor should be comfortable, the patient should be comfortable. All that came from him and an interview that he gave us like 2 years before we ever started Docube. But as soon as we did start Docube, I went and talked to him and he signed on almost immediately, right? He was like, this is a no-brainer for me. At that point of time before joining us, he was working for he was a consultant for a large hospital, and he was doing his own practice in somebody else's clinic. From what I remember, started with 2 hours in Koramangala with me. Came to a point where he was doing well for himself, like 2-3 lakh per month in revenue. Expanded from 2 hours to 4 hours in Koramangala. Then he waited for my JP Nagar center to come up, and then he took up 4 hours in JP Nagar. He's let gone of his consultant job with a large hospital and all the other practices. He today is like, these 2 practices suffice for me. He makes bank, but somehow he also sees his daughter more now, what he tells me. So it's worked for him. It has worked for a lot of other doctors.
Is that something that you sort of, as founder of Docube, is that in your mind that I want to drive this in terms of increasing income for doctors by enabling them to build their own practice?
It was not something that I was the objective, right? It is just like the happy outcome of what we intend to do, because it was a need from the doctor side, it was a need from the patient side. But what we ended up doing is giving these doctors autonomy and and because we don't do a revenue share and we let them
Yeah.
have all the patient fees that they make for their
Yeah.
consultations and their procedures and all that, it led to their success.
Give us an example of how a patient's life has changed.
Definitely. So if I give you a very specific example, I remember one example. Let's call him Samir for today because I can't use the name. So he had come through his employer's insurance to one of my centers, I think Whitefield, and he had gotten everything done and he had such a good experience that the next day he came with his wife and then we had our own health packages that were going on and all that. He got all that done, and then I think his daughter's vaccination also happened during that time at the center. Post that, of course, I don't remember every patient. I remember this patient because like a year later, I ran into another center of mine and he was there. And he came up to me and be like, hey, I used to come to your Whitefield center. Post that, I've changed my job. And because I've changed my job, I've changed my residence. And because I've changed my residence and my employer, my insurance is also different now. So I was actually worried of finding another place where I can get my family with. But when I searched for a scan near me, your name popped up, and then I was so glad that you people are already there in this area also. And then he, again, he's now like a customer of ours who does most of his things with us for 2 years.
So is your customer in this case or in what you're building at Docube, is it the doctor, or is it the patient? Or
it's both, right? And pretending that it's not both is a gross misjudgment and evaluation, right? For the patient, the proposition is simple. I have high quality outpatient care centers where you can get like the top specialists in that area. You can get your scans, labs done, everything in one visit. So you can finish your, let's say you get hospital grade care with the convenience of a 15-minute travel time. For the doctors, it is simple, right? You start and scale your practice. And again, initially it was something around capital expenditure is not there or the operational expenditure is managed and all. Today is not that, right? They've seen growth with us, right? They have grown their practices, and on an average, I do about 3.5x of their subscription fee for each doctor in that sense, in their take home. So and again, they both reinforce each other, right?
I look at this business as a network effects business. You can have digital sort of platforms that are driven by network effects. You can also have physical platforms, and I look at Docube as a physical platform which has network effects. Wanted to pick your view around that, because if there are doctors available, patients want to come in. If patients are coming in, doctors would want to come in, and then there are cross-pollinations between specialities. Today I'm coming for a dentist use case. Tomorrow I might come for an ortho use case. Have you seen that happening?
Oh yeah.
And is that something that you're sort of driving purposefully to build this sort of liquidity and network effect?
Yeah, definitely. So we see that happening. We see the internal referrals happening at every center, right? You will come in, as you said, you might come in for a dentist today. Your wife might come in for a gynecological appointment. We do vaccination of your kid. You yourself can have some pulmonology related issue that you come back for. So we actually have a fairly high cross-pollination rate, right? It's in the 60s range. Wow. So that also happens internally at a center. Now even at a network of 5 clinics, right? We have doctors who are doing multiple centers. We have patients who get coverage from specialty wise for multiple centers. We've been able to move our services across the centers. So the network effect is visible even at a 5 clinic network to us.
How do you decide which specialities go into which center? Have you ever pulled a plug on a center, or let's say a specialty is not working out at a particular center?
No, that would not pull a plug on any center. You would have known.
I would have known
no, so the specialty mix, again, there are 2 factors that determine it. So one is, of course, not in our control, right? It is the market hand that plays, right? Where doctors who are actually confident enough to start their own practice are usually people who have patient pools who are asking them to use it privately. So that kind of corrects for the skill level that is required to start a private practice. So usually we get doctors, say 3 or 4 years after their MD, they work for a large hospital or under a bigger doctor, and now they are confident that I can do my own practice.
Yeah.
So that becomes a big factor. Plus, there are some specialities which are your day-to-day specialities. Right? You have your gynecology, orthopedics, you have dermatology, you have pulmonology, ENT also in that aspect, right? That anyways have a predilection to outpatient care. So those get filled up very easily, and those are the ones that are present at all the centers. But yeah, at some places we'll have like a neurosurgeon and a rheumatologist. That becomes the variable part of the coverage. Usually we have a lot of incoming leads and referrals. We have a conversation with them on phone, explain the model, call them for a visit to the center. We take them around the center. We, of course, explain the model in detail. We then understand what they want to do with their practice over here. And then when the fitment is made is when we give them an offer for 2 hours, 4 hours, so whatever is the requirement at that point of time in that sense. Saying that, I have let go of deals which I thought didn't make the right fit at the center, and we've also let go of doctors that didn't fit into the model 3 months.
So when it comes to the OPD market, this $40 billion market in India, it gets thrown around a lot. Let's be honest, how much of that market can Docube actually address or service?
Yeah, I'll be very honest in this conversation.
The whole idea of Open Tab is being open about it.
So, again, this is only my opinion. If you get really honest about conversations around tab, I don't think founders really care about the tab. Let's take that 40 billion number. It is made up of probably appointment done in the hinterland of a PHC in a village. It could be done super specialist appointments in the hospital. All of that combined kind of makes the OPD market. And of course, I won't see all of that in my lifetime. I'm very sure about that. My idea is, again, every center that we do usually fits into like a 2.5 lakh, 5 lakh population. At that point of time, I want to be the go-to neighborhood outpatient care clinic, right? So those touch points are fairly large enough for me to be excited about, right? Because again, as I said, 85 to 90, and I'm being conservative, healthcare interactions are outpatient care. So if I'm present in a place where in a country where access is already a problem, I would actually make a lot of money. But do I pitch that the market is 40 billion and if I get a sliver, I still have a large company? No.
Is this a metro only model?
I actually do want to be a pan India thing, right? I do see 300 of these centers coming up in a fairly progressive manner in that sense. Of course, the metros would be the fastest upticks that we see, but if you even go down to let's say what tier 1 cities are, you go to a Lucknow, you go to a Vijayawada, you go to Kannur, you go to in that sense, Pune also in that sense. Think about it. Does the health-seeking behavior of patients change? They still require specialist consultations, lab scans, and they are still searching for it either in their friend circle or in their WhatsApp group or online, right? So the health-seeking behavior of the patient is not changing. Does the health-providing behavior of the doctors or brands changing? They still require physical spaces with digital funnels to service their patients well, right? And they require equipment, OPD and all that in that sense. When the two components that make up Docube, which is patient and doctors, if their behaviors are not changing from metro to tier 1 to tier 2, I don't think the model will require a huge pivot for it to work in a tier 1 or tier 2 city.
Makes sense.
If anything, I think I'll be the big fish in the small pond in these kind of cities.
10 years out, how do you see Docube transforming Indian healthcare?
Yeah, it would be nice, a single company transforming Indian healthcare. I wouldn't be that grandiose, but of course, with what I do and if I win the way I want to win, then India will have an independent outpatient care network, right? And the network itself, as I said, is valuable, right? Because it can act as a gatekeeper for your insurance provider, can act as a channel part for tertiary hospitals. More than that, what it would induce is regular outpatient care visits, right? You are getting checked on a more regular basis, more conveniently, and everything is transparent. That will incentivize for you to take care of your health better. That would be the long game for us. It would also, in a way, let tertiary hospital concentrate on what they do best, right? They can go even more deeper in to doing more complicated surgeries, the transplants, the organ transplants and all that. That would become with money. That is where they're investing and that they can get stronger at. So it would be like as we say in hospitals, the outpatient department is discharged from the hospital, right?
No, I think India and everybody, even as investors, we see that Indians don't pay for preventive care. I think one of the primary reasons for that is access and convenience. Because if I have a niggling issue, I'm not going to spend a day going to the hospital, getting it checked, and then do a follow-up sort of consultation. But I believe something like Docube can sort of change that mindset where I start paying for preventive because it is just so much easy to access, and I'm in and out in like 30 minutes, 45 minutes.
Yeah, that's exactly what I'm trying to do. I'm trying to get you in and out of a hospital in 20 minutes, 25 minutes, 30 minutes, whatever is, depending on the services that you avail with apart from the consultations, right? So, right on the money on that one. And also, like, primary care kind of gets a bad rap because you think primary care and then you mix it up with wellness and then well-being and longevity and all that. No, but primary, secondary care are very, very important parts of healthcare, as generally the principles of healthcare are in that sense. So yeah, I'm very shrewd about what is healthcare and what is wellness.
Got it.
Because what's next? You put protein in your furniture and get 30%, 34 grams bioavailable.
Tell me about it. No, all the best, Zeeshan, for your vision for Docube and in your endeavor to bring outpatient care to a patient's or consumer's neighborhood. All the best to you on that.
Thank you.